everyone, and welcome back to the journey. Today we're talking about OB, fetal well-being. Okay, so for starters, females who are high risk for pregnancy are going to go through several different types of tests. There's different types of tests, which is what I'm going to go into further. But for right now, these are some of the women who are going to be your high-risk pregnancy. So mothers that are less than 16 years of age, mothers who are greater than 35 years of age, chronic maternal hypertension, right, and that's the term where we know as preeclampsia. And you also have diabetes, you have chronic complications such as your heart disease type of patients, your RH incompatibility, which I'll go ahead and do another video and I'll explain all there is to know about RH incompatibility. But just to sum it up real short, it is pretty much a mother who has RH negative who is carrying a RH positive blood baby, okay? You have intrauterine growth restrictions, also known as your IUGR, which pretty much means your poor growth of the baby. All right. Also, you have a history of unexplained stillbirth, and your stillbirth is your fetus who are dead, and the mother has to push this fetal demise out. Okay, this dead baby out of her. So those are your stillbirths. Also, you have a history of multiple gestation. She had many pregnancies, or she has current multiple gestation as far as she's carrying twins, she's carrying triplets, quadruplets, right? Siblings, whatever it is, right? Multiple fetuses within the womb, all right? Then we have a history of preterm labor, which is pretty much she is in labor before her due date, okay? So she has labor early on than expected. We also have a history of cervical incompetence, which pretty much the cervix is not able to stay closed. It kind of opens, and because it's opening, it causes the mother to go into preterm labor because the baby can just kind of, the uterus can kind of fall through, right? The everything within the baby. Okay, so you want to kind of keep that shut. It also makes it more prone for infections and things like that. So that's what cervical incompetence is. And then you also have your prolonged pregnancy that is past your 42 weeks. So again, you don't want the baby to come out too early, but you don't want the baby to come out too late. Okay, there is such a thing where it's been in the oven too long. All right. So those are pretty much all the risk factors of women who are going to experience a high-risk pregnancy. So one of the first tests that we can do is your chorionic villi sampling, which is also known as CVS. Okay, so it's the earliest test that can be done. It tests for genetic testing, metabolic, and DNA abnormalities. All right. Also, it can test for things like Down syndrome, family genetic problems like your Tay-Sachs, which is pretty much destroying of the nerve cells that happens within the brain and the spinal cord area. Also, hemophilia, which is a blood problem. Right, you're not able to have those clotting factors to help cause the blood to clot. Okay, so you're more prone for bleeding. You have sickle cell disease and your cystic fibrosis and different other genetic inheritance that you can have, okay? Also, main thing to know, with this testing, it does not, and I repeat, it does not test for neural tube defect. And your neural tube defect is pretty much like your spinal bifida, okay? So, doctors take a small sample of the cells that are from the chorionic villi. And as you remember, or if you guys have not checked out that video yet, I have a video by the name of fetal development, so go ahead and check that out. And it will explain all the different parts of the chorion and the amnion that deals with within the placenta. Okay, so they have finger-like projections, right, on the chorion, the outside part, right, and it disappears after 4 months. So within that time frame, they will go ahead and get samples from those finger-like projections, and those finger-like projections are the same DNA as the fetus. So they pretty much can't get any closer than the actual DNA of the fetus. Okay, so then that's where they get to test all of these different testings to know exactly what's going on with this fetus. Okay, so this test is performed within 10 to 12 weeks. It's 99% accurate. Okay, the results come back within a few days, so that is another pro, right? Instead of having to wait months and months for this test. It comes back within a few days, and it allows you to make early decision making whether you want to terminate this pregnancy or continue on with this pregnancy. All right. Also, there's a risk for spontaneous abortions than other invasive procedures. So this is your highest risk of having your spontaneous abortion. Okay. Also, you have risk for infections, bleeding, rupture of membranes, which is your ROM. So again, I know in med-surg, ROM is your range of motion. When it comes to OB, it is your rupture of membranes. Okay. Your RH incompatibility, which again, anytime you're doing any invasive procedure, you always have a possibility of the blood mixing. Okay, so normally in a regular pregnancy, the mother's blood and the baby's blood do not ever mix, except for when the placenta has to be detached and it's coming off. Then little trickles of blood may mix within the mother's circulatory system, but other than that, it never really mixes. Okay, when you're doing an invasive procedure now, this can cause the mother blood and baby's blood to mix. So medication that you're going to get to prevent her antibodies from developing to attack this baby is pretty much you're going to give Rogam. Okay, and again, Rogam is only going to be given to mothers who have a negative blood type, right? Whether it's A negative, B negative, AB negative, O negative, any one of those options, right? That she has a RH that is negative, right? You're going to give her this if she has a baby who is RH positive. Okay, so that's the only time. So if you are a mother and you have the RH positive, right, you don't have to worry about taking this medication. You don't have to worry about causing any harm to your fetus because, again, it's not going to make any antibodies. Okay? And main thing, you want to monitor the vital signs and monitor for complications during and after the procedure. So with the CVS procedure, you would it can either be done transvaginally or transabdominally. Okay. Also, you would need her to sign consent. So the woman would have to go ahead and sign consent, stating that she understands the procedure, understands the different types of risk factors that can occur. And you also want to answer any concerns that she may have. So that way, when she's going into the procedure, she's fully aware of what's going on and what's going to take place. Okay. Also, you want to ask her to drink a glass of water an hour before the procedure. Why? You want her to have a full bladder so that way she can displace the uterus upward, so that way they can get a closer sampling. Okay? So again, you want her to drink a glass of water an hour before because you want her to have a full bladder. Alright? Also, within the procedure, there's going to be a real-time ultrasound that is going to be in the room as well, so that way it kind of guides the doctor into knowing where everything is located. Okay? So it tells you the location of the placenta, the uterine position, and any other intervening instructions as far as the bowels and also the blood vessels. Okay? Now, another thing you have is the doctor will definitely go in with a needle and retrieve some of that sampling. Okay? So you just want to make sure that you tell her everything that is going to take place, and that way she can be more comfortable, less anxious. Okay? And the person who's to tell her exactly what's going to take place is the doctor themselves. Okay? The doctor will definitely go in and explain and let her know, so that way she's not going in unaware. Okay? And an ultrasound will always be used because the doctors are not going to go in blind, right? They need a gadget to guide them into knowing where they need to go ahead and insert that needle. So we have another test by the name of amniocentesis, and with this test, it's another invasive procedure that the doctor is going to go through the mother's abdomen, and it's going to insert a needle to obtain a sample of that amniotic fluid, hence the word amniocentesis, right? So this test can be done twice during pregnancy. If it's done earlier in pregnancy, it's going to be done within 15 to 20 weeks, and it's going to be testing for your Down syndrome and other genetic abnormalities, okay? And this is mainly recommended for women who are over the age of 35. Okay? Then you have later in pregnancy, and if this test is done later in pregnancy, it's done within 30 to 35 weeks, and it's mainly checking for lung maturity. Okay? So the fetal lung should have an LS ratio that should be 2 to 1. Okay? And if it's 2 to 1, that means that the baby has enough surfactant. And what surfactant is pretty much a substance that the baby needs to help them breathe. It's a substance that kind of helps the lungs stay open in particular the alveoli, okay? Without that substance, the lung will collapse, okay? So at 35 weeks, the lungs should be matured, okay? And if the LS ratio is not 2 to 1, then a medication by the name of celestone, which is your betamethasone, right? It's a steroid medication, can be given. All right, now once this medication is given, it helps to mature the lungs and build up that surfactant, so that way the baby has a less risk of having respiratory distress syndrome. All right, now this medication is given IM and it's given to the mother, not the baby. So with this invasive procedure, this can cause premature labor. And with the premature labor, you know, she has early contractions, which you do not want. So what do you want to do? You want to stop the contraction because you want to allow the medication to work, the celestone to work, right? And it takes about 24 hours. So for 24 hours, your goal is to maintain her from not having any contractions. So another medication that you can give her to stop the contraction is breathine, which is also known as your terbutaline. And what this is, it's a smooth muscle relaxer, so it relaxes those muscles from contracting, right, to give the celestone time to work. All right, so that is the main goal of that medication, and it is given IM 12 milligrams once a day for 2 days. All right, and the more preferred site is your glutes, okay, for your IM injection. And also, the main thing, like I said before, is trying to postpone her labor, right, because you want to give the medication time to work. Some risk factors of the amniocentesis: you have pain, contractions, fever, and chills. You also have eruption of your membrane, which is your ROM, and the RH incompatibility, which that can be with any invasive procedure because you have the possibility of the mother's blood and the baby's blood mixing. Okay, so also, again, just like the CBS, they're going to use a real-time ultrasound during the procedure, so they never go in blind, right? Because you don't want to nip certain things or puncture certain structures, right? So you want to make sure that you're guided in, so that way you know exactly what parts to stay away from and what parts to grab, right, and take. Also, the mother will be given Rogram if she is a RH negative, okay? And you also want to monitor the vital signs and the fetal heart rate if this test is done later on, okay, to check for the lung maturity. Again, the doctor is going to go through the abdomen with a 22 gauge needle and withdraw about 15 to 20 mLs worth of amniotic fluid. So this test, and I put in blue so that way it jumps out at you, this test can test for neural tube defect, okay, and your alpha-fetoprotein, okay. So again, this one can, the chorionic villi sampling cannot. All right. You also want to teach the woman to report signs of, fever or chills, or any hypo or hyper movement of the fetus. Any vaginal discharge, you also want her to notify anyone of that. Also, the woman will be on light activity for 24 hours and increase her fluids to kind of replace the ones that were already taken from the amniotic fluid. All right, and you want to have her empty her bladder, whereas the chorionic villi sampling, you want her to have a full bladder. So amniocentesis, you want her to empty her bladder. So another test we have is the NonStress Test, also known as NST. And this test can be done on its own, or it can be a part of another test, which is called your BPP, which is your biophysical profile, which I'll talk about on later in this video, okay? So it's a non-invasive procedure, but the other two that I mentioned are invasive procedure. This is a non-invasive procedure that includes external fetal monitoring, so obtaining tracing of the fetal heart rate, so FHR stands for fetal heart rate, and observing accelerations within fetal movement. So you may say, okay, what are accelerations, okay? So accelerations are the basis for the NonStress test, and I will go ahead and explain more on a fetal monitoring video that I will have coming up soon. And the acceleration should increase from the baseline at least 15 beats per minute and lasting 15 seconds, okay? So a woman is going to be given a handheld marker to indicate whenever she does feel the fetus move, okay? So it's like a little clicker, and as she clicks, it's going to leave indentations, markings on the fetal heart strip, okay? So she's going to be given that clicker. Now during the procedure, You want to position her semi-flawless, or you want to have her on her side with a pillow or something wedged on her side. Okay, so you don't want her on supine. Supine is just pretty much like flat because of the Vena-Cava syndrome. Now, newer books or information is coming out stating that the Vena-Cava syndrome doesn't really affect the mother, based on the positioning. So sometimes they may say she can lay flat. So just go ahead and check up that information in your books to make sure that that is a new procedure or a new thing that has come out, or new information. Okay, but from when I was in nursing school, I was on the 4th edition of one of the books, and it stated still that they had the Vena-Cava syndrome. So just make sure that that information is updated. Okay. Also, you want to have her void before the testing, just for her comfort, because she is going to lie still for at least 20 to 40 minutes. Okay. And the results should be 2 accelerations, 15 by 15, which I already stated here what the 15 by 15 is. Okay. And once you see that, that is a reactive non-stress test, which this is what you want to see. Okay. A reactive non-stress test is a good thing. All right. That's what you want to see. And the baby may be sleeping, so again, there's times where you may not see any movement at all. It doesn't mean that there's something wrong. Again, the baby does have its cycles of sleep, so you're just going to simply give her a juice, get her to stand up, to move around, to kind of wake that baby up. Or you can have her do acoustics on her abdomen to kind of get that baby moving around, okay? And then once the baby is moving around, you want to redo the test for another 20 minutes. So this test can extend up to 40 minutes if the baby is in a sleep cycle. And then you have a non-reactive stress test, which is one without sufficient accelerations over the period of 40 minutes, okay? So one thing I want you guys to remember is that a non-stress test does indicate if the baby's in trouble, right? It just lets you know that further testing needs to be done, okay, to confirm that idea, okay? But it doesn't mean that something is wrong, okay? So again, it can identify that the baby is doing well, right? Which is what we all want, the baby to be doing well. But it does not identify that the baby is not doing well, okay? Or that the fetus is compromising, okay? So it does not let you know that. It just lets you know you need further testing, okay? So a reactive stress test, okay, is what we want to see. At least 2 accelerations, 15 beats per minute, lasting 15 seconds, okay? And that lets us know that the baby has good central nervous system, is intact, and they're having good oxygenation. Now we have the contraction stress test, also known as CST. And with that, this test evaluates the oxygen and carbon dioxide exchange within the placenta. Now, this test allows us to see if the fetus can deal with the stress of uterine contractions. Now, during contraction, the blood flow to the fetus is kind of reduced, it's temporarily reduced, and in a healthy fetus, they're able to tolerate that reduction, okay? Now, if there is an insufficient placenta reserve, there is going to be fetal hypoxia is going to occur, and the fetal heart rate will go ahead and drop with each contraction, okay, which you do not want. Now, with this test, it's contraindicated if the mother is experiencing signs of placenta previa, third trimester bleeding, incompetent cervix, previous C-section that was a classical incision, premature rupture of membranes, multiple gestation, a history of preterm labor. So with these history, you are not going to induce, you don't want any contractions, okay, while you're doing this test, okay, because this test will not be for them. Now, the interpreted results, what should you see on this result so that way you know everything is okay? So you're going to need a 10-minute strip that has at least 3 good contractions lasting 40 to 60 seconds without any late decelerations. Now, late deceleration is a type of abnormal deceleration that you do not want to see. You have different types. You have 3 different types, and I will go ahead and explain more on that topic when it comes to fetal monitoring. Okay, so with the late decelerations, that is bad. That's when the baby is not tolerating at all, and you do not want to see. So when you have a test that you have 3 good contractions, 40 to 60 minutes, and there is no late deceleration, that is considered a negative result, which we do want to see negative results, because a negative result means that the fetus can tolerate labor without becoming hypoxic. Okay? Now, you have a positive contraction stress test, and that indicates that there is repetitive late decelerations with more than 50% of the contractions. Alright, so that's pretty much half of the times you have a contraction, this baby is not being able to tolerate. Okay, they are very hypoxic. So that is a positive result, and positive means bad. Okay, so think of it like when they say you're HIV positive, right? You want to be HIV negative. Same thing in this case. A negative result means good. A positive result means bad. Okay, and when you have the non-stress test, a reactive, right? Stress test is good. You want a reactive stress test. A non-reactive is bad. Well, not bad, but indicates further testing needs to take place. Okay. Then you have your equivocal and suspicious results, and what that means is that there is no persistent late decelerations or decelerations associated with hyperstimulation. Okay. So these are the different results that you can have. The main thing to pay attention to is mainly what a negative result is. That means something is good, and the positive means that it is bad. Okay, that there is some late decelerations there, and you don't want any of that at all. So in order for the contraction stress test to work, obviously we need contractions, right? Hence the word contraction stress test. So if she's not having them naturally, we can go ahead and stimulate her nipples, or you can have her stimulate her nipples or so. And that can also help the natural oxytocin that's within the body to go ahead and start contracting the endometrium walls, okay? Also, if not, then you can give medication, which you have Pitocin, which is like artificial oxytocin, right? It mimics what the natural substance in the body would do, that hormone. So it's going to be given IV. And they refer to the oxytocin challenge test whenever you have to use it to induce the contraction stress test, okay? So that's just another word or phrase that you hear, the oxytocin challenge test. We're talking about the same thing, inducing her so that way she can go ahead and start having those contractions, okay? Now, remember, like I said previously, you do not want to induce if they are contraindicated, right? Most likely they may have a C-section or so, but you do not want to induce or provide contraction, because you know the baby's not going to tolerate well. Alright? This is for a woman who is going through that process and everything is going well. They don't have those contraindications, right? So, again, Pitocin is a main medication that you're going to see that's going to help with contractions. Now we have Alphafetoprotein analysis, also known as AFP. Alright, and what it is pretty much can be found in the maternal circulation as well as the amniotic fluid, and that's what's going to be tested. So if the AFP is normally produced by the fetal liver, okay, and is present in the fluid surrounding the fetus, so hence the word amniotic fluid, right, and crosses the placenta into the maternal circulation. So that's how the mother is able to also get the AFP. Alright, so this test is done 15 to 22 weeks. If it comes from the maternal serum, okay, it's MS-AFP, which makes sense because you have maternal serum, alpha-fetoprotein, okay, and then you have the alpha-fetoprotein from the fetus, which is the amniotic fluid itself. So if you just hear the word AFP, that's coming from the baby. MS-AFP, that's coming from the mother. Alright, so if the results are high, right, there's an elevation of your AFP, it can indicate that there is neural tube defect. It can also indicate vaginal bleeding or fetal death, or it can just be that she has multiple gestations. She has more than one fetus, right? She has twins, so you just want to make sure that she just has one fetus in there, so that way you can kind of see where this test is going, okay? Now, if she has decreased results, right, it's not that much, it can be associated with Down syndrome of the baby, okay? Now, abnormal results from the MS-AFP, which is from the maternal circulation, does not confirm the results. What confirms the results is when they do the amniocentesis plus the ultrasound, that will then confirm the results, okay? Because that's coming directly from the fetus itself. So, There can be sometimes inadequate dating, which can cause inaccurate testing, right? So let's say she's off from her last menstrual period, right? She said, she was like a few weeks off, right? That is going to change the gestational age because the gestational age is going to be off, right? So of course, the bigger the baby is, the more AFP they should have, right? But if she has given the wrong date, right, according to what she said, you've seen an elevation of it, you may see that it's abnormal, but really and truly, it's just inaccurate dating, okay? So all these different things can play a part. So again, this is the alpha-fetoprotein, and it's found from the fetal liver, and these are certain things that it can indicate based on if those levels are high or low. Next we have nucleotranslucidity testing, which is also known as NTT, and this test can be done between 11 to 13 weeks, and this testing is just a screening showing chromosomal disorders as well as trisomies 13, 18, and 21, and congenital heart disease. Now, to remember the trisomies 13, 18, and 21, a good way to look at it is as ages, right? So these are pivotal moments in our lives, right? When we're first turning 13, right, we're finally a teenager. When we finally turn 18, we're considered an adult, right? And then when we're 21, we can finally drink. So these are pretty much big deal ages, I guess you can say. Not anymore, but 13, 18, 21. So if that helps to remember in any way, great. Now we have this test is for ultrasound, okay? And it's used to scan the translucent area, which is also known as the clear area that's on the back of the neck, okay? Now, it's a non-invasive test, okay, and it's done by an ultrasound, and it can detect 70 to 80% of fetuses with Down syndrome. But again, because the fact that it's only 70 to 80%, right, you want a test that's more accurate, so this is just considered a screening and not so much a diagnostic testing, okay? So, again, you don't want to hear that, oh, you're 70 to 80% positive. You want to know, am I 99.9% positive? What's going on? So it's just a screening, just to see, okay? But if it comes back abnormal, okay, it just means that further testing needs to be done, okay? So it's a screening, and once it shows that you're in that 70 to 80 percentile, further testing needs to be done. What is that further testing? Your amniocentesis, okay? And your amniocentesis is what's going to give a more accurate understanding if, there's neurotube defect, if there's congenital heart disease, right? All those different genetic disorders, it will definitely test and measure those things, okay? So how they check to see, right? You're going to look at the measurement on the back of the neck via ultrasound, and if you see it's greater than 3 millimeters, right, then they're going to ask or refer you to do an amniocentesis to confirm that, all right? So anything greater than 3 millimeters. To continue on with the BPP, right, with this test, like I was saying before, a score of 8 with normal amniotic fluid volume is considered normal. Anything less than that, you're going to have fetal compromise, okay? And this is the only test that can check whether a fetus is going to be compromised or the fetus is healthy, okay? This test right here. So again, this test is all done on the ultrasound, okay? So you can do all 5 categories, all 5 components via the ultrasound, okay? Now with the amniotic fluid, it's seen via ultrasound, right? And what you're going to do is you're going to visualize the pockets of fluid, and it's going to be divided into 4 different sections, and they should range between 5 to 20 centimeters, okay? So that's where it should be. Also, you have fetal growth movement, which pretty much you're going to be looking for active fetal body via the ultrasound, because this test is done through the ultrasound, okay? And if the baby has more than 1 episode of extension of the fetal extremity and return flexion or opening or closing of the hands, we're going to say that that is a good fetal tone, okay? Now, the BPP is going to be done for those patients or mothers who have placenta or fetal high risk. So any problem with the placenta, right, or fetal high risk, you're going to see this test going to be done because you want to see if this fetus is compromised, right? You're also going to teach the mothers to do fetal movement counts, okay, as early as 18 to 20 weeks. And you want them to get in the habit of keep doing that, especially within the second and third trimester of their pregnancy, to start counting, okay? Also, you want to teach her to count 1 hour after eating, same time. You want her to lie there quietly on her side and count at least 2 to 3 times for the day for 20 to 30 minutes, okay? So that is pretty much it with fetal well-being. If you like this video, go ahead and give it a thumbs up. If you have any questions or comments, go ahead and leave that in the comment section below. Please also remember to check out my description box to see added information. And again, if you have not subscribed, what are you waiting for? Go ahead and click that subscribe button. And if you're not following me on Instagram, go ahead and start following me on Instagram so that way you can see my latest videos and just get encouraging doses of nursing material here and there. And again, thank you for watching and coming on this journey. I'll see you on the next one.